We live in an interconnected world. Currently, the world is confronting a global health crisis unlike any other. Health crises like the COVID-19 can pose a global risk and have indicated the crucial need for preparedness. COVID-19, which was declared by the WHO as a pandemic in 2020, continues to increase human misery, threaten the global economy, and disrupt the lives of billions of people around the world. Truly, this pandemic delivers a defining moment for health emergency preparedness, an investment in critical 21st century public services. Yet, the United Nations Development Program emphasized massive inequalities in countries' abilities to manage and recover from the COVID-19 crisis. In line with the celebration of the International Day for Disaster Risk Reduction, UNDRR introduces a framework that highlights the need to substantially enhance international cooperation with developing countries through adequate support to complement their national actions to implement the framework by 2030. Needless to say, a global health crisis calls for globalized effort to ensure good health and well-being for all ages, and these are essential to sustainable development. Welcome to EMDRCM podcast. In this podcast, we talk about zoonoses, immunity, and pandemic, or ZIP for short. ZIP is an action word that means to move at high speed. Here, we will race through and unpack one of the most critical and timely key messages of IDDRR 2021, which talks about zoonotic disease prevention, pandemic preparedness, and equity in vaccine distribution as priority areas for international cooperation. So we are privileged to have a resource speaker with us who will thoroughly discuss the topic today. He is currently the president of the Philippine Medical Association. Let us welcome Dr. Benito P. Atienza. The discussion will be moderated by another doctor, the medical director of the Medical City Clark, Dr. Jacqueline Angeles.
Thank you very much, Doc Benny, for being with us today. We are extremely delighted to have you as our guest. And I know that everyone will be excited to learn insights from everything that you'll have to say because the topic is timely and relevant these days. Doc Benny, would you like to greet our listeners? I am sure they're excited also to hear from you.
Hello, good afternoon to all of you. I'm Dr. Benny Atienza, the president of the Philippine Medical Association, the largest organization of doctors and the oldest. We just celebrated our 118th Foundation Day last September 15.
Thank you very much, Benny. That's a very packed schedule for you. And that's why we are so happy to have invited you, even with so much schedule for the year. So, Doc Benny, I guess we can start now with the questions. So, I'll first ask you about, can you explain to us simply about what is zoonotic disease and what sets it apart from the other types of diseases? And is COVID-19 a zoonotic disease, Doc Benny?
Zoonotic diseases are caused by some insects like the dengue. Infection is brought about by the bite of mosquitoes. This is the main source of the infection, especially during this rainy season. It's one of the most prevalent disease during the rainy seasons in the Philippines, especially for the children and even adults. And as of now, there's increasing number of patients with dengue because it's a rainy season, there is stagnant water, and the signs and symptoms of dengue, fever for several days. Then some signs of symptoms that accompany dengue is the abdominal pain, sometimes with vomiting. And there must be an important test for the first few days of fever, like the dengue and S01 and the CBC complete blood test at home. The blood pressure of the patient must be taken, the pulse pressure, and even the hydration of the patient. If the patient is dehydrated, she or he must be admitted. Then another is the prevalence of leptospirosis. The leptospirosis came from the urine of the rat that contaminated water during the flood. If a person pumunta siya doon sa mabaha or may sugat siya, this is one way that pwedeng pumunta yung infection do sa through the skin. Then maapektuhan doon his or her kidney. Kaya dapat huwag tayong lulusong sa baha na walang bota. If you have symptoms of a decreased urination, may fever ka, dapat magpa-check up ka na. And we have specific drug for that in preventing the occurrence.
Yes, Doc Benny, I know, I realize that a lot of people have been hearing about dengue for the past few
Yes.
years. It's very common in the Philippines, and also, of course, leptospirosis, because we always have flood, we always have baha in our communities. So, Doc Benny, kasi di ba lately we are talking about COVID-19, and we know that COVID-19 came from bats. So, can this be considered, Doc Benny, as a zoonotic disease?
As of now, mahirap pa rin eh. We don't know the real evidence of that came from the bats. Unlike yung galing sa birds, bird flu, established na yan. As of now, like the COVID-19, we don't know yung pinanggalingan kung talagang zoonotic yun. And we need more experts to explain that. We advise our citizenry that during this time of COVID-19 pandemic, we must be careful in ourselves. We have to protect our own self before protecting others by wearing the mask, the face shield. At yung mask mo dapat naman pinapalitan at dapat malinis. What is the purpose of the mask? The mask main protection is that you will not touch the area near your mouth or nose. You clean your hands by washing it or placing alcohol every time nakakain ka or touch mo yung parts na malapit sa nose and mouth. Another thing is that at least 1 meter social distancing. Even you have vaccine, we need to be 80% vaccinated. Vaccine prevents that you will not be admitted or you got COVID moderate to severe. As of now, and na-admit natin mga patients in the hospital, different hospitals, 8 out of 10 were unvaccinated, while 2 out of 10 is partially vaccinated, not severe COVID. Among the doctors, we have 95 to 98 fully vaccinated. And we advise our kababayan to be vaccinated to avoid contracting the moderate to severe COVID-19.
Oo nga, Doc Danny, no? We learned a lot of changes and discoveries all this for the past 2 years for the COVID in terms of transmission, mga sneezing and coughing, and also yung importance of vaccination, not just for our frontliners, pero in everybody. So the less chance of getting severe. So as we go along, we are still discovering new things, Doc Benny, right? About COVID-19.
Yes.
Ang gusto po malaman ng community natin, Doc, is how do we consider po ba isang sakit to be declared by the WHO as a pandemic?
It depends on the number. Sinabi natin pandemic worldwide, kumalat na yung sakit.
For us, doctors, Doc, what are the usual immediate medical response for a pandemic?
The important is the tracing, the isolation, and treatment. Once you're exposed to the person, you must be quarantined for 14 days. Then if you are positive na, dapat i-isolate ka na.
Yes, Doc. So very important po talaga yung lockdown, because as we understand, when you do lockdown, you will prevent the transmission. So from your own perspective, Doc, do you think it was really necessary to implement that lockdown? Of course, initially, yes, but throughout the course po dito sa Philippines, Doc, the way we do our lockdown, is it necessary pa rin po?
Kaya ako nalulungkot kasi the Philippines is a strategic place. We have 7,000 islands. Kung nasunod yung through lockdown, 2 weeks, 1 month na talaga nag-isolate yung mga positive at saka na-quarantine yung mga na-expose, siguro hindi dadami kasi wala mahahawa kung wala ang mga hawa.
Doc Benny, Philippine Medical Association is the largest organization of health workers covering the entire archipelago, the entire Philippines. So, ano po yung mga courses of action that was actually done by the organization to help out during the pandemic?
The first ng pandemic, we caution our doctors and our citizens to be truthful in ourselves. They must tell the real history, especially of travel. We provided PPEs, mask, face shield, and different gadgets to protect ourselves. We requested that mga molecular lab padamihin sa Pilipinas para yung testing mas madami. That time, and have a telemedicine, teleconsulta to prevent influx of patients going to the emergency room. Kung di naman grabe yung sakit, pwede na po through Messenger, Viber, they can answer their patients that time. If COVID, we designated na kung saan hospital sila pupunta. And we made a statement that the Philippine Medical Association with our 119 compound society, specialty societies, subspecialty and affiliate societies will help in the rollout by providing cleaners in the vaccination area, then vaccinators and monitors. Yung monitoring natin, we monitored our kababayan given with vaccines for 15 minutes for monitoring. Actually, we launched a project, this is the Sa Bakuna Nagkaisa, to encourage volunteerism among healthcare workers like the doctors, nurses, midwives, pharmacists, medtech, na sila mag-volunteer to help other areas na kokonti yung vaccinators.
So, Doc Benny, talagang super busy year kayo because you've been on top of all these different activities. So, I think, Doc Benny, the teleconsult is very effective po kasi all our doctors are already involved with this, helping out those who can't go to the hospital. And I understand po during the initial phase where PPE wasn't really available, the PMA was already giving out to our healthcare workers. And this is very important. So, and also volunteerism with our doctors, and now like the vaccination. Was the Philippine Medical Association tapped to be directly involved how the government manages the COVID-19 cases now in cooperation po with the IATF, Doc?
Actually, in our Code of Ethics of Medical Profession, it was indicated that in times of calamities, disaster, the doctors are encouraged to help the community. It's one of our obligations. Last November, we had 3 typhoons all over the country. We have disaster and calamity committee. This pandemic last November, there was a 3 typhoon that hit the Bicol region, Southern Tagalog, and some parts of the north. And we encourage our all organization and NGOs to donate something in the Philippine Medical Association. And we were able to collect 3.7 million pesos from donations from different compound societies, different organizations, and one of the drug company donated 5.5 million worth of medicines to us, and 40 to 40 sacks of rice. Ito yung dinidistribute namin different hospitals, government hospitals, COVID hospitals, and in last November, last year to February, we went to different areas affected by calamities because we have a project, we call it Doctors on Boat, penetrate the flooded areas.
Yes, Doc. So these things, Doc, na you're doing to help out in terms of disaster and now with the pandemic, these are a lot of things po, activities, and of course, mga efforts from the Philippine Medical Association. From your experience, Doc, what are the challenges po in doing all this, specifically now po na in the middle of the pandemic?
The challenges for us is that we have a limited activity that we cannot do face-to-face with the patients. Tsaka limited din yung resources. We must follow the rules of the IATF. Strong coordination.
Yes, Doc. So there's a lot of effort and struggle and sacrifices to do all these things, Doc, no? Which would have been prevented, Doc, if we are able to prepare more and prevent diseases, Doc, right?
Yes.
So parang it's, di ba we always say prevention is always better than cure. So from your perspective, Doc, and of course you're also a consultant and you're practicing your profession aside from being the president of the PMA, in our community, what do you think are the things that they can do to prevent diseases, zoonotic diseases and pandemic? Is it doable, Doc?
It is doable because in the first year of my practice, we have the typhoid outbreak. Typhoid outbreak is waterborne. Ibig sabihin, matubing tubig ang nainom ng mga kababayan natin. In 1996, I am the first pediatrician in our town. There was an outbreak. Outbreak, ibig sabihin, maraming number. Outbreak muna yan bago maging epidemic. Dumami siya kaysa normal number of na magkaroon ng typhoid kasi 1,000 nagkaroon. Kaya outbreak kasi located lang sa isang town sa amin. And that time, more than 1,000 to 2,000 our children and adults had typhoid outbreak. Kami, I coordinated with the DOH, the Philippine Pediatric Society, Infectious Disease, and nag-meeting kami in Batangas to have a consensus bakit dumami ng ganon. And it was discovered that our water source is not chlorinated. This pandemic, health must be taught through your house. Doon sa house pa lang dapat alam mo na how to get your temperature, the height, the weight. Ito yung una kong tinuturo. Then how to compute your BMI. Health is wealth.
So from your capacity, Doc, do you think, because it's important, we talked about a while ago, importance of prevention and preparedness, do you think on a general scale, Doc, as looking at it na parang bahay, of course, bahay natin ng Pilipinas, are we ready or do you think the Philippines is prepared enough for COVID? Do you think is the level of preparedness ng Philippines sa COVID?
Kasi our problem is complacency. Pag nakita natin maganda, balik na naman sa dati. Actually, this is the main thing yung simple, susundan pa natin, yung mga simpleng paghugas ng kamay, yung ganon, before eating and after eating, using the bathroom, before and after, doorknob, little things that cause transmission, pero we neglect it kasi complacent tayo.
So parang sa tingin niyo, Doc, ang pinaka-importante talaga because there's a lot of complacency, yung communication sa grassroots, Doc, no?
Dapat barangay level.
Barangay level. Maintindihan nila kung ano yung mga...
Nakikita nila kung ano yung apat dapat. Yung apat dapat yung air circulation, tapos yung distancing, yung tracing, yung ganon. Dapat alam yon.
Oo nga po, Doc. So parang very important talaga na maintindihan ng mga tao about the importance of all these safety protocols. And now that we are doing the vaccination, they have to understand also na importante din ang bakuna. So, pero Doc, di ba, marami pa rin na hesitant, Doc. So do you think...
the problem of our, kasi it was brought by the dengue vaccine issue 5 years ago na sana nga ang dengue na control natin. Kasi nga, because of politics and different areas, hindi pinakinggan yung mga vaccine expert, masyadong na-politicize yung system, kaya nalito yung mga tao, naka-apekto yon sa vaccination capacity ng Pilipinas. And as of now, out of 10 na bata, 6 lang ang nababakunahan. Ang dami natin na masasahi na vaccines for mumps, measles, rubella, yung tatlong mapipreventa. Ito yung mga preventable diseases na hindi nagagamit yung vaccine.
So do you think, Doc, in terms of equitable vaccination, Doc, do you think who should be getting the vaccines first? Considering po na limited din ang resources natin. Sino po ang dapat maunang talaga dapat na may bakuna?
Talagang dapat, ang tama yung ginawa nila at sinusunod yung WHO criteria, ang dapat talaga healthcare workers kasi tayo ang first vulnerable para mag-exist ang mga hospitals kasi who will man the hospital if the doctors are sick and the nurses are sick?
Sa tingin niyo po, Doc, we will be reaching our target vaccination numbers at the end of the year? Kasi ang dami na pong nagre-request na sana magbukas na mga classes next year, bumalik na sa trabaho yung mga iba. They're all excited to go back to at least what seemed to be normal before the pandemic.
And ang aim naman ng government and the medical communities, we reach the 80% na vaccinated at para maabot natin herd immunity. Ano pa yung herd immunity? Dapat po tayo ay bakunado para doon sa mga bakunado, hindi na sila makakahawa or magle-lessen yung transmission kasi bakunado siya. Yung mamamatay mas kokonti. Tapos mapaprotektahan pa yung 20% na walang bakuna. At least 80% ang kailangan natin. Nasa pa lang tayo, 25 million. Yung first dose ata 17 million.
Sa tingin niyo, Doc, para mapabilis to, there would be a lot of help that we need also, not just within the country, but also international cooperation, Doc. So you think we will be benefiting also, Doc, from international cooperation, right? May ganung experience na ba kayo, Doc, in terms of yung mga international communities helping us?
Community naman, like the WHO, sila nagpo-provide, di ba? Tayo nakauna nung vaccine na bigay ng World Health Organization. Appeal na lang natin sa mga tao, huwag mamili ng bakuna. Vaccines are created equal for our protection.
Oo nga, Doc. So it's very important talaga to get vaccinated. But then there's one more question also for people who are already vaccinated. They're scared because they are hearing about breakthrough cases. So what are your insights on that, Doc? Na parang kahit na bakunahan ka na, you can still get infected.
Pwede ka pa rin mahawa and na-expose pa rin. Kaya nga lang yung mga nabakunahan na itong mga health workers, hindi na na-hospital, nag-isolate na lang sila kasi nag-positive sila to prevent naman yung others na negative para hindi na kumala.
So aside pa sa vaccination, which is very important, Doc, you're always mentioning or emphasizing importance ng safety protocols, Doc, di ba? Kagaya ng isolation, masking, kasi yun po importante sa community natin. So yung iba, Doc, tinatanong kasi like in the provinces, wala silang capability to buy the surgical mask. So they're using the cloth mask. Gano'n daw po kadalas? How often do we change our mask?
Dapat nga araw-araw yan nilalabahan. Mag-ano tayo ng 4 na mask para may salitan. Tapos i-wash mo, bilad mo sa araw para sigurado. Ang main naman ng mask is yung transmission. Importante doon. Kaya ka nakamask para hindi mo mahawakan yung kasi kung saan ka humipo ng mga bagay. Don't know. Contaminated yun. Importante is the ating system. Comorbidity in first the priority natin.
Yes, Doc. So washing the hands is also very important. Dok, totoo ba yung sabi nila na ang tagal ng paghugas ng kamay is kasing tagal ng pagkanta ng happy birthday song?
Oo, ganun. Happy. Yun yung turo namin sa mga bata. That's the most important kasi yung common cause of transmission of diseases.
Okay. Thank you very much, Doc Benny. I think we have learned so much today. Napaka-importante po nang naituro mo from the topic that we discussed about from zoonotic diseases to vaccination, of course, immunity, very importance of safety protocol, and of course, pandemic preparedness, which we are all very interested to learn now. So, and of course, being the Philippine Medical Association president, you are the best person to give us insight. Doc, so we are extending po our thanks in behalf of our course AIM, EMDRCM, and of course our learning team. One, for you to be part of our podcast. We hope to invite you more, Doc, in some other occasions if we'd ask your opinion and insights on things. Thank you so much for giving us time. And Doc, do you have any announcements?
We want the community to know that a healthy community is the most immeasurable wealth of a nation.
So thank you very much, Doc, for being with us. Thank you. And Sir Sam?
Thank you very much, Doc Jack, for moderating that very engaging and very interesting discussion. Of course, thanks to our special guest for gracing this podcast, Dr. Benito Atienza, the president of the Philippine Medical Association. We are really honored by your presence, sir. Now, to our audience, if you'd like to know more about the work of the Philippine Medical Association, you can visit their website at www.philippine-medical-association.org, or you may also check out their Facebook page. Just search for Philippine Medical Association, or you may send your email to philmedas@yahoo.com. Thank you for tuning in. Join us again for the next episode of EMDRCM podcast.